questions. Dr. Todd Allerin, Vice Chair of Medicine at South Shore Health. Good to see you, Doctor.
Hey, Dr. T, it's great to see you. So, Bronny went into cardiac arrest while he was practicing on the court. In your experience, how much time did the people around him have to react at that moment?
Eddie, you have to react really quickly. Seconds is the ideal response. Minutes, okay, but I think we really have to laud the USC medical and athletic staff for really responding quickly, because time is muscle. The key here, and you've heard me say this before, is effective CPR. That means deep and fast chest compressions with a straight arm. You want your heel right at the sternum, interlock your fingers, and compress until you can get help there. Call 911. If you're lucky enough to have a defibrillator as well, this can be life-saving.
Yeah.
Oh, he's
18. 18-year-old young man, yeah.
The family says Bronny is stable, getting standard care. He's not in the ICU. That sounds like good news. You're the expert. What's next?
It's such good news to think that he's out of the ICU this quickly. And I think that's what's important. When you have a witnessed arrest, that can be very helpful if the bystander can, start that CPR quickly. But here's the next step, Maria. We really want to know, why did he collapse? Why did his heart stop? And you have to remember, with competitive athletes, you have to make sure that the structure of his heart is okay, because that's the most common cause, is this what's called a hypertrophic cardiomyopathy, to cause sudden cardiac arrest in these athletes.
Well, obviously, last fall we had the frightening experience of Damar Hamlin, the Buffalo Bills football player, who was actually struck at the point, and that caused it. History is sprinkled with scary moments. Hank Gathers died during a basketball game. 30 years ago, Celtic player Reggie Lewis died from cardiac arrest while practicing with the Celtics at Brandeis University. He was just 27 years old. So these cases do happen. It sounds like they're rare. Who's at risk, Dr. T?
The good news, Eddie, they are rare. Remember, like you said, Damar Hamlin was completely different. That was blunt force trauma. His heart was good, and that's why that the medical experts have said that he can return to football. With Reggie Lewis, it was a different story. He had that hypertrophic cardiomyopathy. What does that mean? A thickened heart muscle that impedes blood flow back to the heart. So the real question here is, what's the cause? And that needs to be done next, so he can be treated. Remember, the hypertrophic cardiomyopathy, when it's diagnosed, there are things that can be done, whether it's surgery, whether it's medications, whether it's implantable defibrillators, and patients can have a good prognosis. So, all my best to his family, and just hopefully good news to come for him.
Indeed. All right, Dr. Todd Allerin, thank you so much, Doctor. Be well. We appreciate it.
You too.
Thanks, Dr. T. Take care.